Hi, this is Dr. Bhargava, and I have a few interesting cases to share with you. Our first patient was diagnosed recently with lung cancer and went through a FDG PET-CT study for whole body staging. This is their rotating image showing the cancer in the right upper lobe of the lung with focal hypermetabolism, some metastatic regional lymph nodes, and extensive uptake in the skeletal muscle. Look at the pattern of uptake involving the upper extremities bilaterally, the lower neck, the upper chest, and also the psoas and some muscles in the lower extremities. This is their primary lung cancer showing peripheral hypermetabolism. There is metastatic paratracheal lymphadenopathy, also metastatic left supraclavicular lymphadenopathy, also called Virchow's node, making this patient's cancer unresectable. On this rotating image, pay attention to the reduced uptake in the brain. These are more images of their brain showing a pattern of uptake consistent with Alzheimer's disease. We see hypometabolism involving bilateral parietal and temporal lobes, and some hypometabolism involving the frontal lobe as well. There is preserved uptake in the sensory motor cortex and the visual cortex. And so it turns out this patient was wheelchair bound, and the uptake that we see in the skeletal muscle in the upper extremities, lower neck, and upper chest is consistent with uptake in the muscles that are used while using wheelchair. And the review of their chart showed that they had cognitive decline, and the FDG PET-CT made the diagnosis of Alzheimer's disease. Our next patient was newly diagnosed with prostate cancer, and a F18 PSMA PET-CT was performed for further evaluation. Here's the rotating image. We see physiologic distribution of the tracer in the lacrimals, symmetric uptake in the salivary glands, uptake in the liver and spleen being more intense than the liver, and excretion from the kidneys into the urinary bladder. Inferior and posterior to the urinary bladder, we see the uptake in the primary prostate cancer, and this localizes beautifully to the right peripheral zone as seen here on the fused PET-CT image, and more superiorly there is focal uptake in the right seminal vesicle. This was contiguous with the primary cancer uptake which we see here, and so the tumor extends to involve the right seminal vesicle, and there is no evidence of metastatic disease. This is a good review article on appropriate use criteria for PSMA PET imaging. Our third patient has history of multiple endocrine neoplasia type 1, has had prior resection of the pancreas, prior resection of the parathyroid, and presented with elevated gastrin levels. The endoscopy had previously shown some tumors that were resected and turned out to be gastrinomas. This time they had a gallium-68 dotatate PET-CT, and here is the rotating image. We see physiologic uptake in the pituitary, we see physiologic uptake in the liver, excretion from the kidneys into the urinary bladder, some uptake in the prostate, and then we see this diffuse increased uptake in the stomach, which is seen right here on the CT and on the fused PET-CT image. They also have metastatic disease to the liver. And so this patient's gastrin level was in the 5,000s, and what we see in the stomach is diffuse involvement with gastrinomas, and findings are consistent with Zollinger-Ellison syndrome. Thank you for watching.